cannot resist asking her this because of her role as the president of the American Academy of Pediatrics. Dr. Beers, in the American Rescue Plan that we just passed, we made substantial changes to the child tax credit that's going to result this year in a cut of childhood poverty in this country by almost 50%. There's a lot of effort now to try to make that permanent. I wonder if you would take a moment to share with the committee what the implications for pediatric medicine and for young children's health care is if they are lifted out of poverty.
Thank you so much for that question. Yes, as I mentioned earlier, nutrition is one of the most important contributors to a child's long-term health and well-being, and actually probably the most important contributor to a child's long-term health and well-being is their economic stability and whether or not they live in poverty, because that in so many ways determines their ability to access and receive any wide variety of supports, including nutrition, good education, stable housing, all of these things that we know can help children be successful and thriving members of our society in through a lifetime. And that is not something that we can just do in 1 year. It really takes a child's entire childhood. And so by decreasing childhood poverty, as the child tax credit does, I think this is an incredibly important strategy, and one that we would really hope to see continue as one of the most important things we can do for our children in this generation.